Hello, my name is Melinda Ortiz, and today I will be informing you about brain tumors. Some of you may know someone who has had or has been diagnosed with a brain tumor. If not, you do now. I was diagnosed with a very rare brain tumor 8 years ago. I was the seventh person in the world to have this particular type of tumor. I had a better chance of winning the lotto than actually being diagnosed with this very rare tumor. I've learned a lot about brain tumors through my own experience and research. Brain tumors do not discriminate. An estimated 66,290 new cases of primary brain tumors will be diagnosed in 2012. Of those, 24,070 will be malignant, while 40,470 will be non-malignant, according to the American Brain Tumor Association. So today I will be informing you of the causes, symptoms, complications, and my own life experience. I will begin with the definition of a brain tumor. The Mayo Clinic staff on mayoclinic.com quoted it as a mass or growth of the abnormal cells of your brain. There are two types of brain tumors: benign, which are non-cancerous, and malignant, which are cancerous. Even though the tumor is considered non-cancerous, patients are not in the clear. These tumors can cause severe damage and even death. According to the American Brain Tumor Association, brain tumors are the second leading cancer-related deaths in children under 20. They are the second leading cancer-related deaths in males ages 20 to 39. And they are the fifth leading cancer-related deaths in females ages 20 to 39. So what are causing these tumors to form? According to kidshealth.com, brain tumors originate from a normal cell that begins to grow abnormally and multiply too quickly. Eventually, these cells develop into a mass called a tumor. The exact cause of this abnormal growth is unknown, though research continues on possible genetic and environmental causes. Complications from the type of tumors include blood clots, depression, muscle weakness, mood and sleep changes, and headaches. The complications will vary from patient to patient depending on the location of the tumor in the brain. Now that I've told you about the causes and complications, I will inform you about the symptoms. Again, symptoms will vary depending on the part of the brain that is being affected by the tumor. Symptoms are seizures, headaches with or without impairments, double vision, hearing loss, speech problems, loss of movement or sensation in one arm or leg. According to the National Brain Tumor Society, other symptoms include confusion, disorientation, and memory loss. So, I've talked about the causes and complications and symptoms. I'm now going to move on to my final point, which is my personal experience with a brain tumor. 10 years ago, I began to develop severe headaches, imbalance, and left-sided weakness. I was referred to several neurologists and specialists, and for the first 3 years, we could not find anything. I did 5 MRIs, all came back normal. In November of 2004, I had a seizure that put me into the hospital. After several days of tests, they found my tumor, and it was running all the way down my brainstem. It affected cranial nerves 2 through cranial nerves 11. After several days, we decided to go ahead and have surgery. What was to be a 3-hour surgery turned into an 8-hour nightmare. The tumor was wrapped around several of my cranial nerves. A month later, I was able to leave the hospital, but not without some neurological issues. I lost total hearing loss on the right side due to severed nerves. I also had to have 2 additional eye surgeries to correct double vision and to have cosmetically normal vision. As of today, I'm still pretty much a guinea pig at the Southwestern University of Dallas. We just pretty much watch my tumor, and I go for MRIs every 6 months to a year. It is a slow-growing tumor, so we just are at the watch and wait stage. So I hope from this search you now know more about brain tumors because I have explained the causes, complications, symptoms, and my own life experience. So if you don't know someone before with a brain tumor, you do now. Thank you.